Hello everyone, welcome to my micro-teaching of the last chapter, the topic related to oncology. I picked content regarding to thyroid cancer, so I'm going to talk about the definition of thyroid cancer, where it would be happening, the symptoms, when to see a doctor, the causes, and some risk factors, and so on. So let's begin. So, thyroid cancer is a growth of the cells that starts in the thyroid. So, the thyroid is a butterfly shaped gland located at the base of the neck, so just below the Adam's apple. The thyroid produces hormones that regulates heart rate, blood pressure, body temperature, and weight. So thyroid cancer might not cause any symptoms at first, but as it grows, it can cause signs and symptoms such as swelling in your neck, voice changes, and difficulty swallowing. And several types of thyroid cancer exist. So most types grow slowly, though sometimes can be very aggressive, and most thyroid cancer can be cured with treatment. And thyroid cancer rates seem to be increasing. The increase may be caused by the improved imaging technology that allows healthcare providers to find small thyroid cancer on CT and MRI scans done for other conditions. And the thyroid cancers found in this way are usually small cancers that respond well to treatments. So let's talk about symptoms. So most thyroid cancers don't cause any signs or symptoms early in the disease. As thyroid cancer grows, it may cause, like you can touch a lump or a nodule that can be felt through the skin on your neck, a feeling that it's close-fitting shirt, like the color of the shirt, becoming too tight, and the voice of change, voice sound like differently, including in an increase like a hoarseness. So the voice going to be a little bit hoarseness, and difficulty swallowing, swollen lymph nodes in your neck, like you have different like a lymph nodes, and pain in your neck and throat. But we need to know when to see a doctor. So if you experience any signs or symptoms that worry you, make an appointment with your healthcare provider. And causes, the next part is causes. So thyroid cancer happens when cells in the thyroid develop changes in their DNA. So a cell's DNA contains the instructions that tell the cell what to do. The changes, which doctors call mutations, tell the cell to grow and multiply rapidly. The cells go on living when healthy cells would naturally die. The accumulating cell from a mass is called a tumor. So the tumor can grow into invade a nearby tissue and can spread like a metastasis to the lymph nodes in the neck. So sometimes cancer cells can spread beyond the neck to the lungs, to the bones and other parts of the body, to brains as well. And for most thyroid cancers, it's not clear what causes the DNA changes that cause the cancer, unfortunately. And the next part is risk factors. So factors that may increase the risk of thyroid cancer include female sex, like the female gender. Thyroid cancer occurs more often in women than in men. And experts think that it may be related to the hormone estrogen. People who are assigned female sex at birth generally have higher levels of estrogen in their bodies, and exposure to high levels of radiation. Radiation therapy treatments to the head and neck may increase the risk of thyroid cancer. And also, if a person can carry the inherited genetic syndromes, may have higher risk of having thyroid cancer too. Um, so, how to prevent for high risk for people at high risk to the thyroid cancer? So, adults and children with an inherited gene that increases the risk of like a medullary, medullary thyroid cancer may consider thyroid surgery to prevent cancer. So, discuss this option with a genetic counselor who can explain your risk of thyroid cancer and your treatment options. They are professional. So the next part is prevention for people near nuclear power plants. So like people with higher genetic mutation risk, they need to get avoid with nuclear power. So a medication that blocks the effects of radiation on the thyroid is sometimes provided to people living near nuclear weapon plants, or like in the United States or in other parts of different country. The medication that is potassium iodine could be used in the unlikely event of a nuclear reactor accident. So if you live within 10 miles of a nuclear power plant and are concerned about safety precautions, contact your state or local emergency management department for more information. Okay, next I'm going to talk about this in Mandarin version. 接下来呢，我就用中文给大家解释一遍。今天咱们来学习的课程呢是甲状腺癌。甲状腺癌是从甲状腺开始生长的一种异常的细胞增生。甲状腺呢是一个蝴蝶形状的腺体，它位于这个颈部的底部喉结的正下方。甲状腺呢可以产生调节心率啊、血压啊、体温还有体重的一个激素。甲状腺癌呢最初可能不会引起任何症状，但随着它这个生长，它会引起一些体征和不适的症状，比如说颈部的肿胀啊、声音变化，还有吞咽的困难。甲状腺癌呢有多种类型，大多数类型的生长比较缓慢，但某些类型可能非常具有这个侵袭性。大多数甲状腺癌可以通过临床治疗、手术或者是其他方法。药物治疗来治愈，但是最近我们发现甲状腺癌的这个发病率似乎正在增加。这种增加呢，可能是由于成像技术的改进造成的。像比如说很多患者可能在甲状腺癌结节很小的时候，就通过 CT 或者通过核磁扫描已经发现了成型的癌症。通过这种方法呢，发现的这个甲状腺癌的小结节通常是对治疗反应比较良好的一种小的癌症。甲状腺癌的症状呢，在疾病早期可能不会引起任何体征或者症状，但是随着这个肿物的生长，它可能会导致，比如说通过颈部皮肤感觉到一些肿块或者结节，感觉系衬衫的时候这个领子变得比较紧。声音发生变化，包括声音嘶哑呀、加重啊这种，吞咽困难，然后颈部的淋巴结可能会有肿大，颈部和喉咙的疼痛。我们遇到什么情况会需要看医生呢？如果您出现这些任何令您担心的这个体征或者症状，要及时的就医，到医生这里去预约。下面我们来说一下甲状腺癌的这个原因是什么。一般来讲呢，当甲状腺癌的这个细胞 DNA 发生变化的时候，就会发生这个癌症了。细胞的这个 DNA 包含就是告诉细胞的做什么的一些指令，这些变化呢，在医学上被称为突变。它可以让细胞快速的生长和繁殖，越过这个自然凋亡的这个终点，细胞会继续存活。所以说，积累的这些细胞就不断的形成一些比较大的肿瘤的团块。这个肿瘤继续生长呢，可以侵入到附近的组织，并且可以扩散，也就是转移到颈部的淋巴结，转移到肺部、骨骼或者头脑、头颅里面像脑组织啊这些其他的部位。对于大多数甲状腺癌呢，目前尚不清楚是什么导致了这个癌症 DNA 的变化。但是有一些风险因素是比较明确的，就比如说女性就是比男性更容易获得这个甲状腺癌。有专家认为呢，这可能和这个女性身体中雌激素水平比较高有关，因为出生时这个性别被DNA 定义为女性的这个人体内雌激素的水平通常比较高。还有就是暴露在比较高水平的辐射下，也就是说头部和颈部有的患者可能经过其他的癌症会做这个放射治疗。这一个治疗的过程呢，也会增加这个甲状腺癌的这个风险。 还有就是一些遗传性的综合征，增加甲状腺癌风险的这个遗传综合征，比如像包括家族性的甲状腺癌的积聚呀，多发性的内分泌肿瘤啊，还有家族性的这个腺瘤性的息肉病。有时候呢，在家族遗传中的甲状腺癌的类型，包括这个甲状腺的髓样癌和乳头状甲状腺癌。但这些高危人群通过怎样的预防方式呢？就如果明确具有这个增加甲状腺癌样风险的这个遗传基因的成人或者儿童，可以考虑进行甲状腺的手术来预防这个癌症的发生。这个东西咱们叫预防性甲状腺切除术。这个具体的操作过程需要你遗传的咨询师来具体考虑您个人的情况。他们可以根据您患甲状腺癌的这个风险和这个概率来进行一些治疗的建议。还有就是在核电站附近的人员也需要进行甲状腺癌的预防。在美国呢，有时候会向居住在核电站附近的人们，提供一些阻止辐射对甲状腺有影响的药物。这种药物实际上就是碘化钾，它可以用于这个万一比如说核反应对发生事故啊，或者说您平时就是长期居住生活在工作在距离核电站10英里范围以内的这种高危的范围，并且担心这个有一些安全预防的措施的话，也请您可以联系当地的州啊，当地的这个所在的政府还有一些应急的管理部门，以获取这个更多的信息。